Welcome to DABCC Radio,
where smart people listen.
Virtualization and Cloud Talk,
Featuring cutting-edge solutions from the hottest companies around the globe.
broadcasting from the DABCC offices in sunny Sarasota, Florida.
Surrounded by computers, books, and Legos.
A Microsoft MVP, Citrix Charter CTP, VMware vExpert.
And your host, Douglas Brown.
Welcome to another episode of DABCC Radio. We have a great episode for you today. A really interesting conversation with a gentleman who's the CEO and founder of a company called Lua, and they make a really phenomenal, very modern, futuristic solution for enterprise messaging. And they're focusing on the healthcare space, but it also applies to other verticals too. So if you're not healthcare, listen. And if you're not healthcare, listen for no other reason than this guy is just phenomenal. And the conversation, I'm recording the intro after the fact, is really a great conversation around messaging, around the futuristic, IT really. And I hope you guys enjoy it. So we're going to talk about how messaging can solve problems within healthcare, make you allow you to be HIPAA compliant, all that jazz. But we're also going to talk about a bunch of other stuff too. So I hope you guys enjoy the episode as much as I enjoyed recording it. So with no further ado, here's my interview with Michael, the CEO and founder of Lua. Okay, Michael, thank you so much for taking the time to be with us today. I'm looking forward to this. You guys have something a little bit off the beaten path for me, but yet it's right in what we all do too. So this is neat. This is new technology, right? This is the future. And I'm excited about learning more. So on that note, thank you for being here. And as always, we'll just dive straight into it and get to my first question, which who are you and what do you do over at Lua?
Yeah, well, first and foremost, thanks so much for having me today. My name is Michael DeFranco. I'm the founder and CEO of Lua. I started this company in 2010 while I was an undergrad at Wesleyan University, and really got inspired to, use enterprise messaging as a way to, change the workflow in our everyday lives. But was really inspired around work I was doing around Hurricane Katrina and watching first responders in the field, really juggle multiple devices just to get their everyday work done.
Absolutely. And a little bit about your past. Where do you come from?
Yeah, grew up in outside Northern Virginia. Mother's native Hawaiian, father's Italian. And so, the inspiration for Lua also came from living in that household. Both of my parents were building technology at the time, mapping and database systems. And I was also surrounded with a Hawaiian culture. And so the foundation of Lua really came from, pieces of Hawaiian martial arts that taught that warriors could achieve silent communication during battle. Interesting.
Is Lua a Hawaiian word?
It is, yes. And so there's many definitions for it. But the martial art aspect of it, explained that if warriors trained enough at night, when they entered battle, they'd have this coordination between each other, and they could actually achieve silent communication. And so with the secure messaging that we're providing to our users, it's a similar sort of philosophy and mindset.
Very interesting. Very interesting. Yeah, DABCC doesn't have a cool meaning. Actually, it really has a great story behind it, but it's not a cool word. Okay, so let's talk a bit about Lua itself. So you told us a little bit about why where it came from, but can you talk more about Lua in general? Give us the big picture.
Yeah, so Lua is really secure mobile messaging that allows employees to really leverage the speed and ease of texting in their everyday lives, and really harnessing that power. And we also offer calling, file sharing, and more. And so we really have an extensive experience in both the enterprise, most recently helping in the healthcare space.
So we've been hearing a lot about healthcare and HIPAA in particular, and in the news lately. And you guys are really focusing the company on this in the messaging solution on this area. Why is secure messaging important in that space?
So I think this is an incredible time in healthcare IT. I think there's a bit of a renaissance going on right now. A lot of it is coming from the regulators. And so HIPAA, which really stands for Health Insurance Portability and Accountability Act, these regulations at this point are requiring healthcare organizations, whether they're a hospital, a clinic, or a laboratory environment, anywhere where they're sharing what's called PHI or private healthcare information, anything that is identifiable about a patient, whether that's a name, an illness, or a photo, if that's unsecurely shared, that's in violation. And so, especially in 2016, these regulations have really increased. And what they're requiring, especially moving into this year, is some sort of mobile messaging platform. In the past, especially last year, you could get away with a HIPAA-compliant email server and sort of check off that box that we're compliant. But moving into this year, regulators really do understand that a lot of this information is coming off of email into text messaging. Healthcare is a profession where doctors and nurses are already using their mobile device as a primary form of communication. When you speak with a doctor, what they'll tell you is that they feel bound by their Hippocratic oath to do whatever they can to streamline the care of their patient. And if they have to send a few texts to a nurse to get answers faster, they're going to do that. And so where Lua comes into play is allowing them to, number one, stay compliant and ensure that all that data that's being shared is in a secure place and you're able to use it cross-platform. But two, where I'm seeing the renaissance part of this industry unfolding, is really allowing them to basically take on all the productivity and increased workflow that comes with deploying new technology. And we're seeing, big budgets being created in mobile technology really across the spectrum, but especially for mobile communications, it's now a time where doctors and nurses and their healthcare staff are able to level up, take that budget and really increase the care that they're giving out every day.
Very cool. Well, first of all, thanks for explaining what HIPAA stands for. That's one that that I'm always like, what is it? HIPAA? So that's great. Second of all, that's neat stuff. That's neat. And you mentioned earlier that you guys do calling and file sharing also. Can you maybe are the doctors using? Well, can you expand upon that area there?
Yeah, so starting with the file sharing, what we do is we allow you to hook into third parties or electronic medical record, EMRs that you might be using, so you can pull and push that information more securely, really using messaging as sort of the highway and allowing you to now share information not just internally, but different colleagues that you might have. What we're seeing a lot of now are doctors actually being able to share results faster with laboratory environments and actually have researchers take a step in and provide value quicker back out to the patient. And so you're seeing a speed of collaboration between different practices within the healthcare industry where they're trying to share information faster. And so whether that's an X-ray or a genome file or a photo of a new illness, these are all being shared faster than ever before. And so a piece of Lua is not just the messaging aspects, but actually being able to share rich data, again, whether that's voice or video or a photo or a file more quickly between each other. And so that file sharing aspect of Lua is really important. The calling piece is interesting as well. Sometimes you're in a group conversation with 5 people, messaging back and forth, but sometimes just pressing one button, getting everyone on the phone instantly with no dial and no passcode, with the click of a button, that really transforms the way you're able to care for your patient. So again, being able to cut corners when you need to again ensure that patients are being provided the best possible care. A lot of times it means picking up the phone and getting someone's opinion. And so we really value the calling and the document sharing as much as the messaging. And again, keeping it all in not just an encrypted, but a simple to use platform.
Very cool, very cool. And I imagine so you can really do all three things. You can text, you can share the messages or files, and then you can also call the people too. Reporting, is there any auditing or reporting?
Yeah, so both auditability and accountability are really important. And so for the accountability aspect, anytime you can send a message or a document, you can see in real time who has and has not read it. And so I think a lot of us take for granted the the access we have to multiple devices. So, right now I'm speaking to you on a cell phone. I have a laptop in front of me with some notes. I also have an iPad in the room. And I'm not wearing it right now, but I also have a wearable device. I'm able to communicate and share data across all platforms. We really strive to make that simple and easy. But when you enter the healthcare space, since they are sharing such sensitive data around patients, most of the time they're extremely limited in the access of which devices they can actually use. And so something I found out pretty recently that I found fascinating is, on average, a nurse is spending 4 hours, is walking 4 full miles. So at any given shift, a nurse is walking 4 miles over the course of her whole shift, because she's walking back and forth on the floor from a patient's room back to her desk where her terminal is, back to a patient's room, and then back to her desk. And that's because she's not able to use a tablet or a mobile device to collect that patient data. She actually needs to sit down at her console, at her terminal, the computer at her desk, and input that information. And that's because that desk is set up to be secure. And so just being able to, cut the amount of miles that a doctor or a nurse is walking over the course of their shift, and allowing them to capture that information while they're with the patient in real time, all of a sudden you can actually be getting real time feedback. And so at this point now, a nurse can be with the patient, can actually be messaging a doctor in real time, sharing updates that the patient is telling her in real time, sending that to the doctor, and sometimes getting real time updates. And so that all sort of goes back to your question about accountability. So, we first start with allowing doctors and nurses to now access multiple devices as work endpoints. And so that accountability is really important. So when I send a message to 3 people I want to see in real time, not just who, that 1 out of 3 have read it, but actually who read that at what given time. And so there's timestamps in addition to real lists of who's viewed and not viewed. And it's not just for messages, it's also for files. And I think that's unique to us. So you could send a lab result to 10 different people. You can see, within an hour that only 2 have read it. If it's something that you think is time sensitive, you can send a message to them saying, I really need everyone to read this. You can continue to check that. If you need to escalate it, you can just press that phone call and start that conference call. And so again, we view accountability as an action item. You're able to take action based on where people are in their information digestion. So that's all a form of accountability. And then you do have the auditability of the system. And so as an administrator, you're able to review at any given point, the communication that's going through the system. So it's not like someone sitting there reading all your messages, but they're able to at some point do an audit and say between X and Y date, this is the communication that occurred between, our different practitioners. These are the messages, these are the files that were shared. These were the calls that were sent. So you do have, this trackable data that's showing which data is coming in and out of the system, which at some point, if you are audited by the OCR, which is really the regulation group that is enforcing HIPAA for the U.S. Department of Health and Human Services, if they ever come knocking at the door saying, we're trying to see if you guys are secure, you can turn over these audited files and you can say, number 1, we're doing our jobs here, and that's really first and foremost for them.
Makes sense. Makes total sense. Well, other than compliance, what are some of the other benefits of using secure messaging?
Yeah. And so again, on the theme of this, really exciting renaissance in healthcare IT, people are using compliance as a way to drive budget and get, workforce transformational tools. And so, we always start the conversation with, level 1 is just right now you're not compliant. You want to be. Let's give you a system that has that security. But step 2 is actually taking that and harnessing the power of what mobile communication can do for you today. And so a lot of this is just being able to do actions faster. So having an internal directory of all users broken down by department and position. You might not know someone's name, but you know what department they live in. You can send a quick message or a file through that since it's already set up for you. And so all of it is really speeding up the workflow. And again, not necessarily just within the staff in your location. And so we work with many groups that have multiple laboratories or multiple hospital systems where they actually want to communicate with doctors outside of their walls and get a second opinion or share maybe an x-ray from one building to another, even if you're cross-border. And so for us, the compliance is really a step 1, but the step 2 is really delighting that end user and seeing, how much we can enhance the patient stay in your facility.
Makes total sense. So, is this we've been talking about healthcare, but I imagine this is not a healthcare only play. There's other verticals that can take advantage of it. Can you talk a bit about that?
Yeah, we do work with some financial institutions, so some large banks out there, being able to coordinate and communicate between different branches, or you say with their, with their clients. For some of the larger investment banks, we work within the hospitality industry with some airlines and some hotels. We do some work with the U.S. government in a variety of different agencies, some of them military related. And we do have a practice with disaster relief. But I think first and foremost, healthcare is a place where it's not just the workflow and the need is there, but the compliance and regulations are basically making secure messaging mandatory in the industry. So I'm actually viewing them right now as, fast forward 3 years from now, I truly believe that if the trend continues, that healthcare providers are going to be some of the most advanced users of secure communications and the creativity, that can come out of putting a few systems together and seeing, how we can reduce that patient's time and get that lab result back out faster.
You got it. I like how you describe it as a renaissance within healthcare IT. That's it. There's so much neat stuff going on in that space. It's phenomenal.
Yeah. And what I think it is, we've sold into other industries where, Microsoft is really the incumbent. We can take, top Fortune 500 companies. A lot of them are really, getting a lot of the innovation blocked by IT. There's so many things they need to fix. And sometimes they look at communication and say, we have Outlook, we have Skype for Business, we're good to go. But when we actually look at the adoption rate of Skype for Business, it's not really being used, and especially for that line of business worker. So if you look at, a trucking service or a bottling plant or a theme park, all these workers are unconnected, not using Skype for Business, but they're under that same IT umbrella. So I'm really seeing IT stifle a lot of innovation around communication and maybe just upgrade to the next Microsoft or Cisco product. While in healthcare, Microsoft Skype for Business isn't HIPAA compliant unless it's on-premise. And so they're actually reaching out to smaller vendors. There's no real incumbent in this space yet. And so it allows a lot of, small companies with big ideas to, get into the battleground, compete with each other. But the winner really is the end user. And so, now that there's budgets created for things like secure messaging in the healthcare industry, they can actually go and explore the best solutions and not have to fight for budget with IT because it's now become mandatory. So I feel like they're able to leverage these regulations into increasing their entire workflow with new technology. And so I think for a first time, you're seeing healthcare IT move at a speed which you even look at, 2 to 3 years ago, it wasn't really happening.
I wanted to ask you about how you compare it to the big boy Skype for Business. And so I had it actually written down. And in many ways, you answered that question, but anything else? Because people are going to, they're going to say, well, we use Skype for Business. But I guess in the healthcare, you answered that. It's just not compliant.
Exactly, especially in healthcare, it's not HIPAA compliant. You can't be sharing PHI through it, but just in general, sort of tool for tool, Skype wasn't designed as a mobile-first user experience. I think it's a great tool for video conferencing. It was an interesting acquisition at the time for Microsoft, taking a consumer tool that was really built by anarchists that were looking to have really secure communication with each other, and not really, be able to see who the other user was, and actually trying to throw that into a regulated enterprise world. And so a lot of the infrastructure isn't necessarily scalable for quick mobile messaging and group creation. So I know that threaded messages is really one of the biggest concerns with Skype for Business. It's hard to keep track of the different conversations you're having with the same users, but I think really, again, first and foremost, it doesn't have the best mobile first user experience. And if people can't feel that they're getting the best out of their tool, there are other options out there like Lua.
You got it. It's a very typical thing, I think. It's retooling old technology for the new world, right? And then we have the new technology that's built for the new world, like Lua. And then Skype being, legacy. And there's nothing wrong with that. That's not a slam towards Skype for Business or Skype or what have you. It's just, we grow, right? We learn, we get better.
Exactly. I feel like, mission-driven technology, especially in the enterprise, needs to really be there by birth for it to have thought out, every single edge case of what their user is going to be going through. So, what I really like about the origins of Lua is that, we were focused on disaster relief work. We have, a whole nonprofit arm of Lua where we help first responders in places like Nepal and Haiti, and helping with the Syrian refugee crisis in Greece. And so, being able to get that feedback when we're initially deploying the software. So we really focus on, not draining your battery, working in very low connectivity, what it truly means to be unconnected, and try and work in that kind of world. And so we really battle tested this system in the real field. It's one thing to test QA your software in an office with Wi-Fi. It's another thing to give it to someone that's walking through Nepal that is only getting cell connection every few hours. And if they can't do their job with your system, you haven't really battle tested it correctly. So we have a whole offline mode that works pretty well. That as soon as you're connected again, everything is going to send. And I think those are the things, really the under the hood, the engine of your system, that I think is the most important piece of success, in a new deployment of a mobile first messaging system.
Makes total sense. So if somebody's interested in this and they're required to do it, what does it need, or what does it take to get up and running, right? How do they bring this? What's the process like to bring this to their end users?
Yeah, and so I think another reason why messaging is so fascinating in the healthcare space is how quickly we can deploy it. I mean, there's great technology coming out right now that's helping them across their entire workflow, from new population, healthcare population control software to new versions of EMRs to scheduling. But those do take some time to set up correctly and make sure that you have all those workflows put together. For mobile messaging, I think we really delight healthcare IT departments because we're able to deploy possibly at the end of the first call with them, or really a second call. So all we're going to do is really pull over your users, whether reporting them from Active Directory or LDAP, or just manually taking them by email address. And it's just as simple as pressing send. Everyone gets that invite. They're synced into a single directory. Everyone has each other's contact information. It's no longer intermingled with your personal life. You no longer find yourself, doing work in your iMessage inbox where the rest of your social life is, or in WhatsApp. You have your own secure app where your contacts, your conversations, and your documents live. And so I think, I think we were able to close faster sales cycles because they can start using it, after one or two conversations, and it just works. If you're just looking to become compliant, we can get you there overnight, and then from there we can show you all the added benefits of, an increased, fully fledged enterprise messaging system.
Very cool. So you guys have AD support. What is that process like? You said pull in their data or their users. How does that work? What's that process like?
Yeah, and so typically, not everyone's AD is always up to date, but it's a good starting point.
Sure.
And so we have an integration point through our administrative console where you can, our team works with yours, and we basically sync over, move those contacts over into ours, and create them as Lua users. We also have single sign-on and OAuth, so it's pretty easy to be able to sign in with the same security keys, get into Lua. We're able to sync that on a regular basis just to see if users have come and gone, that it's syncing with Lua.
Makes sense. You mentioned admin console. I'm an engineer by training. When I hear admin console, I want to learn more. So what do I see? What is this admin console? What do I do in it? What type of information does it give me?
Yeah, I think our admin console is one of the more fun ones out there. We have a ton of information. It's really easy to use. And so first and foremost, the admin console, really the design of it was to basically take all user management capabilities and take it out of the front-facing UI. So on the mobile and the web app, you're not going to see add user here or customize any user settings. It's all on the back end. So it allows us to have, for most end users, a much cleaner experience, and it gives us a lot more real estate to add features over time. So, all that contact and user management lives in that administrative screen. And so you can have a list of users, and from there you can actually begin to customize security features. So I think that's where the beauty of Lua really comes to life, is on the back end. And so, you can really become as secure or not secure, insecure as you'd like. And so it starts with, single sign-on, but then being able to say, maybe we want obscured messages, which means, for some organizations, when they send a message with a push notification, they don't actually want any of the data to show up. And so they just want to say, Doug sent a message and you don't get any of the message data. That sometimes is a HIPAA risk. Yep. And so we can turn that on and at that point obscure the message body. And so that's something you can turn on or off, and this is up to you. A second is being able to set, PIN codes, and you can say, every hour you need to put in a PIN code, or every 2 days you need to put in a PIN code. So it's both the action, turning on that 4-digit PIN code as you log into the app, and then the frequency of it. So again, these are customizable features. You can do as much or as little as you want. You can also set, every hour or so, the web signs itself out. Again, something you can turn on and off, and also add the frequency. You can also purge messages. So say every 30 days, I want all the messages to delete and basically expire from my device. And at that point, everything will delete. Or you can keep the data forever, and you actually have similar to Gmail, full rich search. And so you can search that for a contact name or a patient name or a keyword. And so you have all these different security features that live in the administrative console. Also the ability to send what we call broadcasts or one-way messages to certain subsets of users that they can't respond to. It's a notification. I need you to know this, but I don't want a response. I don't want a long reply all email chain, but I do want to see who has and hasn't read it. And then finally, we also have analytics. And so you're able to see full analytics, pretty transparent. In the first 2 days of deployment, are people actually using the system? Are they sending messages? Are they reading the messages? We have a very high read rate across all of our customers. So are people making calls or sharing files? So within 2 days, you're seeing who's on it. Within 2 weeks, you can see if this is working or not. And most of the time, by that point, we're able to tell, is this a company that has the right culture that's going to adopt this and really start to utilize it? And then we also go from there and visualize what we call cord graphs, and you can actually see, different departments and positions, how users communicate with each other, and how that shifts over time. And so you can look at, the last month, this is how we were communicating. We want to increase communication between X and Y department. And you can actually make that as sort of a 30-day goal that we're going to increase communication between these groups. And so, we understand that Lua is just a subset. Most communication happens in person in real life. It happens still over email. But a cross-section of how people are speaking on Lua, it's pretty indicative of how, the rest of the organization is communicating with each other. So all this is packed together with very simple UI in the administrative dashboard, and also accessible off a mobile app. And so I think the most used feature there is actually resetting people's passwords. Or logging them out. And so if someone's left a device somewhere, which is really the number one place where data leakage comes from, you can reach out to an admin and they can just basically press remote wipe. And then, your passwords reset, you sign out of the system, everything's locally cached, it's not downloaded to the actual device. And so you capture all that and you can stay compliant. And so being able to sign into a mobile app to manage your users, I think people really appreciate.
Absolutely, absolutely. And along that line, most enterprises today, if not all enterprises today, are going with EMM solutions, right? Do you guys have any integrations in with existing or with EMM solutions to make it, easy to deploy within that framework?
Yeah, absolutely. We have great partnerships with leaders like VMware's AirWatch, we've been working very closely with. And so it'll allow you to take an AirWatch managed environment. It'll take just a few minutes to make Lua available to all those users, and you have all that added administrative control over them through AirWatch, and you get even more with Lua, and it's really easy to manage and turn that on. We also have a great partnership with Citrix's Zen Mobile, and a few others like IBM Moz 360.
Very cool, very cool. So back to the end users, or back to the training side of things. So we've talked about the admin side, what it takes to install. So now we've deployed this thing. What does it take to train the users? What's their experience like?
Yeah, I think the most important piece of training actually comes from the design. And so, even before you deploy software as you're building it, keeping that end user in mind and thinking about what's their first, 30 seconds, 1 hour of the system going to look like. Are they going to how much training do we think they're going to need? And so a lot of that is trying to create it as simple of a UI as possible and having it mimic, the consumer apps that they're using in their everyday life. We're at a point in time where the consumer world is really far ahead of where the enterprise world is today in terms of functionality. And so you're always getting users comparing, the social free apps that they're using in their consumer life and wanting to implement that into their enterprise world. And so I think, the best training comes from already having created a simple to use app. But where we take that a step further is our customer success team. And so our customer success team enters the conversation pretty early into the sales process, letting that prospective client or user know that we do have a team here that's ready to support and train and onboard and support you over time. And so we can be as hands-off or hands-on as possible. We can send a team do a full onboard in person and physically make sure that everyone's downloaded the app to their phone. But most people prefer something remotely, where we have a few sessions where we're able to just give them a quick demo of the system, talk them through the different use cases that the organization has agreed to use this for. And I think that's an important piece of this, is that Lua is really mission focused and mission driven software. You use Lua for a purpose. You use it to do your work. It's not a chatty place where you're sharing gifts. It's for people in real life situations where time is critical and they need to do their jobs faster. And so from the beginning, sort of saying the expectation that this is going to be something that's mission driven, that we're solving problems with, is important, just for the psychology of how you use the application, so that when you do get those first Lua dings and those notifications, this is for work, this is important, and that you should either get to it quickly or let people know that you're unavailable. But that team is always there ready to support you. So we actually have real Lua representatives accessible in our directory that you can reach out to anytime with frequently asked questions or to help you manage a process. There's an interesting anecdote. A few years ago, before we were in healthcare, it took a few years to actually get those security requirements put into place and get approved by HIPAA to serve the industry. We were working with the Super Bowl when it was in New York City, and we did a ton of training. We got all the volunteers set up. And they were like, all right, we're using new technology. We're using tablets. We're passing them out to volunteers. These aren't, NFL full-time employees. These are people we just met. We're really relying on them to, keep the stampede of the public out of the way of all the officials and the players, when you walk into the Super Bowl, and the day of the game, it was below zero in New York City, and they actually saw, I think, 30 to 40% of their trained volunteer staff just didn't show up on that day. Wow. And so you can imagine the fear as more and more people are showing up for the game, and they are severely understaffed, and so they were sort of freaking out. We had a plan B, which was we had pre-set up all their standby employees. And so we were, they were able to activate them really quickly. The volunteers were running in, right as people were arriving, and they were able to be handed an iPad. Pretty much had minimal or no training, and they said, here's the system we're using for the day, you're all set up, and they were able to take that and run with it. And so we had a team that was working all day from our offices, onboarding new volunteers, making sure that people were ready to go. And so we're able to do that in very time-sensitive situations. And so we like to tell those stories, let people know that we've been through sort of the worst before, and we really do have their backs if something does go wrong and they need to onboard new users or switch permissions quickly.
Very interesting. So how do you not show up for the Super Bowl? I think I'm staying home today. I don't feel like going to the Super Bowl. Did they give you tickets to the Super Bowl? Did you get a go?
Absolutely not. No. They did give us discounted tickets that were still in the thousands of dollars.
I was going to say, a ticket to the Super Bowl is like gold. That's like Willy Wonka's golden ticket. Right?
Yeah, no, it's sort of standard when you work with the Super Bowl that you're not going to get a ticket. They sort of say that right away.
Yeah, is that up front? We don't get tickets. But we'll work with you, but you're going to have to buy the ticket.
Yeah.
And you're like, okay, sure. Yeah. But I can get a ticket, right? Yeah, you can get a ticket. Okay, I'll buy it. That's a perk. That's a perk within itself.
Yeah, but the funny thing is, I think most of those volunteers were probably at home in the warm watching the game, because the majority of that staff was stationed outside of the stadium or in Manhattan, an hour away from the game itself. So those people weren't going to be able to be close to the field anyway, and I think they opted to stay in their warm homes.
Wow, very interesting. Well, that's a good story right there. Do you have any other customer success stories you'd like to share with us real quick?
Yeah. There's an awesome one where we have a user, Allison Thompson, who's an amazing first responder. Worked with Sean Penn around Haiti. Was one of the first people on the ground. She has a mission that when she goes into a disaster zone, she's going to have a team set up there for at least 10 years. And that's because all the responders get down there. They're there for the first few months, and everyone disappears, and the community is maybe the rubble's been cleaned up, but, their life has been turned upside down. And her group comes in and they empower the local community to create leaders that are interconnected with her workflow, and keeps a few people on the ground, but basically trains a larger community on how to rebuild, moving forward. And so she'll have people on the ground there for the next, 10 years working with them. And so, when we got her up on the system, she just got more and more excited, started adding more and more people around the world, now has this global network of people that, is something, the earthquake in Haiti, the earthquake in Nepal, she was able to get aid there within 24 to 48 hours, where in the past it took 7 days. And so the reason it took so long in the past was because, they would get stopped in customs or at the border. And with the messaging system, she was able to have people already put in place to basically, it's easier for a package to get through than an individual. So sometimes you just have someone meet you somewhere, they would take that aid to the next side, they already have the right passport, and just those small things allowed her to get supplies all the way out to Nepal, faster than she'd never been before. But she gave me an interesting story that she likes to tell, so I'll repeat it. She didn't give me permission, I wouldn't, but she was telling me that when Nepal occurred, she was actually in Haiti on the ground working. And our team at this point is in real time trying to activate this network for her and add people. So we're getting truck drivers, getting helicopter pilots up. We're getting different leaders of aid material set up. And she said that she was the sort of eureka moment for her happened when she was sitting in a bathroom stall in Haiti, messaging with a handful of helicopter pilots, and actually was able to help someone. That was actually stranded on Mount Everest, and a whole group of people up there get evacuated out. And so for her, she said that was one of the craziest moments of her life, being able to multitask all that in real time, with all these users, basically being, added in real time as well. And so, we've really dealt with worked with a lot of amazing people. And, I was sort of grew up learning that, technology can be used to do a lot of things, but if it can be used to help the real world, that's really the best version of yourself that you can be. And so I think we strive to put ourselves in those difficult situations to sort of stress test and see, how much we can do with this system.
I'm really impressed by you guys. You're not just a tech company, but you're a community conscious tech company, right? You're looking at how we can use tech to solve people's problems above and beyond just from the tech side of things, or, how we usually think of it, right? I really like that. That's very commendable. That's really neat. And I bet you do work with a lot of really interesting use cases and interesting people too. So that's really cool, Michael. I'm kudos to you guys.
Appreciate that. Thank you.
So that being said, if somebody wants to try, can they try this? How do they learn more? And can you talk about that?
Yep. And so we have a website, getlua.com, and you're able to, right now it is healthcare focused, but we do serve a wide variety of industries. But if you're out there and you're looking for HIPAA compliant messaging, we can get you up and running within 24 hours. And so right now it is a contact request, and we found in the past that some of our users weren't able to onboard themselves quickly, and midway through would abandon the process. And so, we've been sort of tinkering and tooling with the best way to get, these groups up and running. So right now you're able to make a contact request. Someone will get in touch with you, within the hour, and we can, talk to you about how an onboarding and training can go. But I think by the end of the year, we're going to have the self-serve ready. So you're able to come in and just start using it with your users.
Very cool. Very cool. So I want to ask you your wealth of knowledge. This is great. I'm really enjoying this. So can you maybe talk about some other trends that's happening within healthcare tech?
Yeah, absolutely. And so again, this is such an exciting time to be in healthcare. All across the board, you're seeing innovation occurring. And so I think a big piece of this is empowering the patients and really patient-centric care. And really, patient-centered care. And so, the big change that's happening is that they're putting patients at the center of care. Since patients are in the consumer world of technology, they expect when they go to the doctor's office that everything is going to move as quickly as everywhere else in their lives, and this is not where it's at right now. I was at a doctor a week ago, and I spent about 20 minutes just doing paperwork before I walked in the door. They're trying to transform and automate that. They want you to be able to walk in the door. They want you to be able to first, schedule an appointment digitally off their website, fill out all your paperwork, have that one file be able to transfer forward for you and fill out as much as you can before you get there. And, when you sit down, you should already have the paperwork filled out. You should just be able to go in and see the doctor. And so if we think about, the time, doctors and hospitals are a business. And so, they're able to maximize their own revenue if they can see patients as quickly as possible. And so I think the frustrating thing here is both the patient wants to get there and get out as quickly as possible, and the doctor wants you to come in, him to treat you, and for you to get back to your life as quickly as possible. And time is money on both sides. And the thing that's stuck in the middle right now is a manual process. And so I think across the board, innovation is trying to increase that patient's, that patient's experience so the doctor can see them faster. And there's a wide range of different pieces of technology that are helping that. But I think that's sort of the theme, is that patients are now at the center of care, and doctors want faster ways to reach them. And so I think a piece of that that's critical is, telemedicine and telehealth and the future of that. And so everyone is going, including us, is, once you're able to get internal communication done, how do we actually start treating the patient faster? And so a piece of what we're launching very quickly is to allow doctors to communicate directly with their patients and share in a HIPAA-compliant manner. So basically, a doctor will be able to send you an SMS link, and from that open and have a secure communication have a HIPAA-compliant conversation around that and share you some files. But the whole aspect of telemedicine is a concept that doctors and patients don't necessarily need to be in the same room to have the right treatment. And so being able to use mobile devices and video chat to basically make a more cost-efficient way for patients to receive care and completely transform the way that we look at doctors' visits. And so there's a lot of great people out there that are 100% focused on that. But I think, telemedicine is not just good for us, in the U.S., but it's something that's international. If you think about some of the most remote areas in the world, why can't a kid in Haiti actually have access to the best doctors in the U.S.? If you have an iPad and you have that whole thing funded, then you can just have that doctor sitting in New York City giving aid to disaster zones, seeing people one by one. And so all that takes is a screen. And at this point, screens have become so cheap, that there is really no excuse that we're not all pushing to get the best care possible to the to the most remote areas in the world. It just takes a screen, and it takes some people that are really mission driven for that. But so telemedicine and telehealth is something that we're extremely interested in. I think another.
Go ahead, please.
Yeah, I think another piece of that is harnessing big data. And so, where we are in terms of collaboration, I don't think we've ever been at a place where so many different doctors can share their research as quickly as they can now. And so, we're at a point now where there is so much data out there that organizing it, streamlining it, and getting researchers' results faster to caretakers allows that patient to get information faster and sometimes save a life. Sometimes find a trend and a correlation with a disease that's similar, and actually, get someone some experimental care faster. And so all that big data, is swirling around. And again, it's all about getting the right treatment to the right patient as quickly as possible. But there's, we work with some really interesting people that are solving big problems around genome, human genome, and linking all of that. And there's a lot of concern around the security of that. I was just at dinner about a week ago with an advisor, and he said what we're all gearing up for in our industry is the first big genetics data leak. And he said when that happens, it's way bigger than anyone imagines, because it's not just the individuals whose genome that we've collected, but it's every single blood relative is now completely affected and vulnerable. So if there's some sort of hereditary disease in your family, if that leaks and that's on the internet, everyone knows, everything, not just about you, but all your relatives. And also, potentially if you're pregnant, people can start to wonder, maybe there's a disease that way. And if that gets in the wrong hands, it just creates a big mess. But, their mission is to solve the human genome. So they need to be collecting and sharing this data. And so, there's a big piece of that where they feel like where they are and where the security is not intertwined as well as it could be. And so, all the security around that is really important. And I think there's a trend to securing the big data as it's being shared, because I don't think there's an industry where the data is as sensitive as it is in healthcare. And then another interesting trend is just wearables. And so not just, doctors using iWatches, but also at this point, I think it's 70 million people in the U.S. are using wearable tracking devices to monitor all aspects of their life. So whether that's a sleeping pattern or calorie consumption or physical activity, the more that they're able to track their everyday life, the better the doctors are to solve real world problems. I have some friends with diabetes, and I remember them in college. I remember them, and I see them now, and the way in which they're able to sort of track their day to day and feel empowered that they don't have to look at they don't have to be as careful at every single step because they're monitoring it on a daily basis. It's transformed the way that they live their life. They're happier people, and that was all because of technology. And so, the wearable tracking, I think, is shifting a lot. It's going to teach us a lot about how we can improve our health moving forward. But then that also moves into the actual hospitals themselves, and in the future, places that have all seen Minority Report. Why can't a doctor that's in surgery be able to have a screen in front of him and be researching in real time? There's actually this would be an interesting time to sort of shout out one of our former office mates here in our Lua offices in New York City, a company called Sketchfab, which is creating sort of a SoundCloud for 3D imagery. So they're capturing some of the best 3D images out there, putting it in a single database. And so, they actually helped save a child's life because there's a child that had heart failure, and he'd just born. He had heart failure. He was about to die. And there was something, a bunch of doctors got together over the course of the day, and they basically took a scan of the heart, and they created a 3D image of it, and they put it, and they projected it, looked through just a Google cardboard, and when they turned the heart, they actually found something on the back end that they couldn't see on any scan that they had noticed from some research they were doing in the past. They pulled up one of those research reports, put it side by side, and said, "Holy shit, we know what to do here." And so they tried something really innovative with the kid, and they actually saved his life. And so that couldn't have been done without 3D imagery. And the way they did it was really hacked together. They did a scan, they put it into free software, they use cardboard Google imagery, and they turned something. There should be an enterprise version of that's in every hospital in the world, because the 2D imagery on MRIs and X-rays in the future is going to completely transform again to these 3D images, and I think things are going to move a lot faster at that point. So it's a way of saying that healthcare is a really fascinating space right now, and I think I enjoy working in it because everyone there is mission driven to save lives faster, and it correlates well with our culture here of using technology to help.
Yeah. Well, that's phenomenal. That's really, really phenomenal. I love the big data side of it too. Big data really interests me. There's nothing that's not possible with big data, right? And
absolutely.
And I love what Apple's doing too. They're doing a lot of what you talked about, is trying to use the data, use the people, use that footprint that they have to solve people's problems, right? To make the world a better place. Isn't that just such a commendable idea?
Yeah, absolutely.
So yeah, I love it. And you mentioned wearables, and that was actually the last thing I had on my list. Was you had mentioned it earlier in the podcast too, but do you guys have any plans for an Apple Watch or any wearable extension pieces to what you guys are doing?
We've had that live for a bit, so we have a subset of users that use that. I haven't met an organization that has greenlit iWatches deployed to doctors, but you do get a doctor here and there that has it, and it is technically HIPAA compliant to send messages through there, so it's a fully hand-free work environment where you're going to get a notification from Lua. You're able to either view it, you can press and record a response that'll type out in front of you, and then it'll send, or you can edit it. And really interesting, if you see a message come through, you can actually mark it as read. And so just a small thing like that allows, if you don't want to respond because you're busy, you mark it as read, letting them know that you've read it. And so those small things just allow people to work faster than ever before. But we have that available on both iOS and Android now.
Very cool, very cool. Yeah, I love my Apple Watch, and people ask me, why do you like it? What do you use it for? Well, for me, it's all about notification, right? Yeah. It's all about, okay, great. I don't have to open up my phone. I just, exactly. In fact, twice while I was just recording, I got buzzes. Well, my phones are all off, but I just moved my arm. I was like, okay, cool. I know this is happening. And it just speeds up that time to market, right?
Absolutely.
It's just wonderful.
Yeah. I'm excited to see where the wearable market goes, because I feel like a doctor should be able to sit with the patient and be getting updates in real time about what's going on around them, and just whether or not they respond to it, just seeing that stream coming through. And especially with Lua, you can turn off all the other notifications while you're on shift, except for the mission critical ones, and just that doctor is going to walk out of that office and not have to take a minute to catch up. He's fully there, and if you need to leave, you can get up and go.
Interesting. Can you prioritize messages then? Can you say like this one's mission critical, and can I do that from let's say I'm Dr. Doug and I need to message someone else, but it's really important. I want them to see this one. Do I, as the end user sending it, be able to sort of categorize it?
So we're actually working on a rules engine where you could sort of change the priority of it. Right now, you can turn off notifications for other networks and just for the one you're on shift for, you keep that one running.
Okay. Makes sense. Well, Michael, I really love this. This is really interesting. You are a wealth of knowledge and extremely articulate too. I really, really loved it. So that's all my questions. I'll throw it at you. Is there anything we left out? Anything else you would like to add?
I mean, I guess the only thing I would add, I was having lunch with a friend today, and was sort of going back to the foundation of the company, and for me, Lua means a lot. It's sort of Hawaii itself is going through a renaissance right now of cultural pride, and we do Hawaiian chanting in the office. I have a lot of hula groups coming here and working. We have Hawaiian language classes twice a week that are taught here, and what I've really found is that creating a great company culture comes from sharing a piece of your culture with your employees and having that be a part of your everyday life. And so that's something that I love to do. I love to incorporate our the ancient philosophies of Hawaii and apply them to modern day life. And so even in our computer code, we have Wakea, which is sort of like Father Earth, as a piece of our computer code, and we've named each of our different servers after different representations, whether it's a volcano or a waterfall. And to us, I think it allows us to sort of take ourselves out of I think too many people take themselves too seriously, and if you just sort of take a step back and make it fun. And just focus on something that you love to do and helping people. I feel like a lot of it just begins to sort of come together and crystallize for you.
That is so great. I love it. Now, I don't like names for servers that are not do not have naming conventions, though. I'm an old engineer, and when I'd walk into a data center and you'd have Pluto, Venus, and Mars, I was like, I don't know what Pluto does. I don't know what Mars does, but I know what Lua M01 2K 16 means. It's Lua's mail server. It's running 2016. You know what I mean? So that's just the engineer in me. That was one of the things I used to preach: is no funny names. I need to know what these things do by looking at them.
Yeah, absolutely.
So, I would get very mad at people like, no, we don't do that. We don't do that. So, anyway, Michael, thank you so much. This has just been really great. I've learned so much, and I've enjoyed chatting with you. So I hope we can have you back on in the future. Maybe we'll bring you on and just chat about just technology in general. I think you could do that for an hour, couldn't you?
Yeah, I'd love that.
Yeah, that would be fun.
Thank you so much.
Hey, thank you. Okay, so that concluded another very successful episode of DABCC, and I hope you guys liked it because Michael is a really amazing guy. Were you guys as impressed as I was? You bring on a lot of people, and no disrespect for anybody, but Michael's one of the most articulate guys I've had on the show, and yeah, very, very impressed. Please check out what these guys are doing. If you're in healthcare, you need to check out what they're doing. But it just any other verticals too. You can utilize this type of technology. It's not healthcare only, right? And to really speed up communications, to make your lives better, right? To make your end users' lives better, and bring them into the modernize them, right? And gosh, I hope you guys enjoyed this as much as I did. I as I told Michael when we hung up, I really enjoyed this podcast. I really did. So I do a lot of these. And I really enjoyed this one. So on that note, I hope you guys did too. Please check out dabcc.com for the latest and greatest IT news and support, virtualization, cloud, desktop security, messaging, mobility, you name it. We do it within this IT world. Complete ground up rewrite. So it's beautiful. It's fast. It's easy. It's modern. It's wonderful. And the stats are going up, which are telling me that people like it. And that's always a good thing for the stats going up. But it's a better thing that people like it. So definitely head over to www.dabcc.com for the latest and greatest. And we have a mobile app coming too. So as soon as that thing is, I'm just waiting now. It's out of my hands. I've done everything I need to do. The product is finished. I'm just waiting. to get the thing live, right? And so what else do I say? But thank you to each and every one of you guys for listening. If you like the show, please tell a friend. Email somebody. Tweet about it. Let people know you like the show. I'd greatly appreciate that. And with no further ado, I'll just say thank you for listening to the ABCC Radio.
Can you say DABCC?
DABC.
Say it again, DABCC.
DABC.
Can you say it again, DABCC?
DABC.
How about DABCC?
DABC.
DABCC.
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 DABCC.